What are the walking pneumonia symptoms in adults? Pneumonia is a lung infection that can affect one or both the lungs. The air sacs of the lungs alveoli are inflamed due to inflammation. The inflamed alveoli are filled with pus and fluid, hence the individual finds it difficult to breathe. The infection can be caused by bacteria, viruses, fungi, chemicals, etc. Different bacteria can cause walking pneumonia, such as Mycoplasma pneumonia, Chlamydia pneumonia, and Legionella. Mycoplasma pneumonia is the most common and causes the milder form of pneumonia. Legionella pneumonia, Legionnaire's disease, is a dangerous form of pneumonia that can lead to respiratory failure and death. What is walking pneumonia? Walking pneumonia, also referred to as atypical pneumonia, is the milder form of the infection. Mild pneumonia remains asymptomatic, and if at all the symptoms appear, it can be seen in the form of cold and flu. Mild pneumonia does not require any bed rest or hospitalization. The individual will be walking and can follow the daily routines without much struggle. Hence the name walking pneumonia. Walking pneumonia symptoms in adults. Atypical pneumonia symptoms are the same for both adults and children, and one should stay at home until the symptoms subside. People tend to go out in public if they feel better, but they are prone to spread the infection. The incubation period for walking pneumonia varies between 15 to 20 days. The symptoms worsen in the next 4 days after the incubation period. The infection can be in the lower and upper respiratory tract. Walking pneumonia symptoms in adults include chest pain. As the alveoli are filled with fluid, the lungs put lots of effort into breathing. A deep breath will be painful. Inflammation in the windpipe. Rapid and labored breathing. Wheezing. Abdominal pain. Headache. Fever with chills. Sore throat. Tiredness. Dry cough. Vomiting. Abdominal pain. Weakness that may last until the symptoms subside. The other symptoms include ear infection, anemia, or a skin rash. Risk factors for walking pneumonia. Walking pneumonia usually occurs in children and people who are not older than 40 years. People should avoid crowded places when suffering from mild pneumonia. A person suffering from it should avoid public places, schools, dorms, etc. It is most common in late summer and fall. 1. Age. Children below 2 years of age and above 65 years are at risk of developing mild pneumonia. The immune system is underdeveloped in children and weakened in older people. They are prone to atypical pneumonia. 2. Secondary infection in hospitals. People who have been hospitalized and are on a ventilator are likely to develop mild pneumonia as a secondary infection. 3. Immunocompromised patients. People who have undergone transplantation, chemotherapy, HIV or AIDS, and long-term usage of steroids have compromised immune systems. Smoking and unhealthy lifestyles further increase the risk of infections. 4. Pregnant women. The immune system is altered in pregnant women. They are at increased risk of infection and cause premature labor. Mild pneumonia can also lead to death during labor and birth. 5. Respiratory diseases. People suffering from asthma, emphysema, and chronic obstructive pulmonary disease are at increased risk of developing an infection. Home remedies for walking pneumonia. Home remedies cannot help you in fighting the infection, but do provide symptomatic relief. Here we offer home remedies for symptomatic relief. 1. Saltwater gargle. It helps in removing mucus from the throat and relieves irritation. Preparation. Dissolve 1/4 teaspoon salt in a glass of warm water and gargle. Make sure the water is not hot as it can burn your mouth. Gargle for 30 seconds and spit it. Repeat it a couple of times in a day. 2. Peppermint tea. Peppermint is a proven decongestant, anti-inflammatory, and painkiller. It helps in preventing irritation in the respiratory tract and removes mucus. It is available as bagged tea or makes fresh peppermint leaves tea. Even the aroma of peppermint tea can help you clear the nasal passage. Preparation. Wash and cut the mint leaves, add boiling water, and steep it for 5 minutes. Milk, lemon, and honey can be added for taste. 3. Drink warm water. It helps you stay hydrated and also keep yourself warm. 4. Hot soup. It can help you provide energy and also provides warmth. 5. Coffee. It is composed of theophylline, a bronchodilator that helps open the airways in your lungs. Coffee provides symptomatic relief that can last up to 4 hours. 6. Turmeric tea. It possesses anti-inflammatory, antioxidant, and antimicrobial properties that can help in pain relief. Turmeric is available as a capsule in various stores or buy turmeric tea bags. You can also make fresh turmeric tea. Preparation. In 2 cups of boiling water, add 1 teaspoon of turmeric powder. Simmer the liquid for 10 minutes, strain, and serve with lemon and honey. You can also include black pepper powder as it can increase the absorption of turmeric. You can drink as many times as you like.